Drug abuse and its repercussions have long been pressing issues that transcend socioeconomic boundaries, affecting communities globally. The intertwining challenges of drug abuse, homelessness, and the opioid crisis have created a complex web of social issues that demand careful examination. In recent years, the emergence of novel substances, like Xylazine, has added another layer to this intricate problem. The opioid crisis in the United States has reached alarming proportions, claiming countless lives and devastating. Factors contributing to this epidemic includes overprescription of pain medication, inadequate regulation, and the subsequent transition to illicit opioids. The repercussions of the opioid crisis extend beyond the individual level, affecting families, communities, and the healthcare system. Originally intended as a veterinary tranquilizer, Xylazine has found its way into the illicit drug market, particularly in regions grappling with the opioid addiction. The drug, known colloquially as tranq or zombie, poses significant health risk due to its potency and unpredictable effects. Xylazine exacerbates the challenges posed by the opioid crisis, as users may unknowingly ingest it alongside other substances. The drug's sedative properties can lead to respiratory depression, increasing the likelihood of overdose. Moreover, the emergence of Xylazine highlights the adaptability of the illicit drug market and the constant need for vigilance in addressing new threats. Emerging drug trends pose an ongoing challenge for public health, law enforcement, and communities worldwide. As societal dynamics evolve and the global landscape of drug production and distribution changes, new substances continually emerge, presenting unique risks and complexities. Understanding and addressing these emerging drug trends is critical to developing effective strategies for prevention, harm reduction, and treatment. One significant trend that has gained attention in recent years is the use of synthetic opioids such as fentanyl and carfentanil. These potent substances, originally developed for medical purposes, have found their way into illicit drug markets, contributing to a surge in opioid-related overdoses. The alarming potency of synthetic opioids increases the risk of overdose even with small quantities, posing a severe threat to public health. The internet and advancement in technology have played a pivotal role in the rise of novel psychoactive substances. These substances, often designed to mimic the effects of traditional illicit drugs, are created by modifying the chemical structure of existing compounds. Cathinones, commonly referred to as bath salts, represents another category of emerging drugs. These synthetic stimulants can induce effects similar to amphetamines or hallucinogens and have gained popularity in certain demographics. Bath salts, coupled with their potential for adverse health effects, makes them a concern for public health officials and law enforcement. Novel benzodiazepines, a class of drugs commonly used to treat anxiety and insomnia, have also emerged as a growing trend. Illicitly manufactured versions of these substances, often referred to as designer benzos, pose risk of overdose and dependence, further complicating the landscape of substance abuse. In addition to these specific substances, polydrug use and the combination of various drugs presents a complex challenge. Individuals may unknowingly ingest multiple substances, increasing the likelihood of adverse reactions and complicating treatment efforts. Moreover, the emergence of substances like Xylazine, originally intended as a veterinary tranquilizer, highlights the adaptability of the illicit drug market, as users may encounter new and unexpected dangers. The intricate relationship between homelessness and drug abuse is a complex and cyclical phenomenon that significantly impacts individuals, families, and communities. The intersection of these two challenges creates a compounding effect, exacerbating the difficulties faced by those who find themselves caught in this web of adversity. Homelessness often serves as both a cause and a consequence of drug abuse. Individuals experiencing homelessness frequently confront a myriad of stressors, including lack of stable housing, unemployment, and social isolation. In an attempt to cope with the harsh realities of life on the streets, many turn to substance abuse as a means of escape or a way to self-medicate underlying mental health issues. The connection between homelessness and drug abuse is further underscored by the financial strain experienced by individuals living on the street. The need for daily survival, coupled with limited access to resources, can drive individuals to engage in illegal activities, such as theft or panhandling, to support their substance abuse habits. This cycle of desperation often perpetuates a downward spiral, making it challenging for individuals to break free from the grip of addiction. Conversely, drug abuse can also contribute to homelessness. Substance abuse can lead to job loss, strained relationships with families and friends, and financial instability. As the negative consequences of addiction mount, individuals may find themselves without a support system or a stable living situation, ultimately culminating in homelessness. The challenges faced by homeless individuals with substance abuse issues are compounded by social stigma and limited access to healthcare services. The pervasive stigma surrounding addiction can create barriers to seeking help, as individuals may fear judgment or rejection from society. Kensington Avenue in Philadelphia, a thoroughfare once known for its historical significance, has unfortunately gained notoriety in recent years due to the profound impact of drug abuse and the opioid crisis on its street. As one of the epicenters of the opioid epidemic, it has become a stark representation of the challenges faced by urban communities struggling with addiction, homelessness, and the associated social issues. The prevalence of makeshift encampments, tents, and discarded syringes paints a disheartening picture of the human toll exacted by the opioid crisis. The streets are rife with individuals in various stages of addiction, their lives entangled in a web of despair and dependency. Homelessness is not merely a consequence of economic hardship, but is intricately linked to the pervasive drug abuse that permeates the area. Many individuals experiencing homelessness have succumbed to addiction, using substances as a means of escaping the harsh realities of life on the streets. The encampments, often located in abandoned buildings or vacant lots, serves as temporary refuge for those with nowhere else to turn. One of the most pressing concerns is the alarming rate of opioid-related overdoses. Emergency responders and healthcare providers in the area are strained, responding to a relentless stream of overdose cases. The widespread use of potent opioids, such as fentanyl, has contributed to the severity and frequency of overdoses, placing an immense burden on local emergency services and healthcare facilities. Community organizations and activists have rallied to address the crisis on Kensington Avenue. Harm reduction initiatives, including needle exchange programs,